name's Keir Young. I co-lead the University College London study of posterior cortical atrophy, sometimes referred to as visual variant or visuospatial Alzheimer's disease. And I work with people living with various degrees of dementia-related visual loss. A substantial proportion of individuals living with Alzheimer's disease who appear normal on ophthalmological examination exhibit difficulty perceiving what or where things are. These difficulties are consistent with the degeneration of cortical regions, particularly towards the very back of the brain, which reduce our capacity to reliably interpret and represent visual and spatial information, ultimately resulting in diminished brain sight rather than diminished eyesight. Molecular imaging techniques have increasingly enabled the visualization of the hallmark pathology associated with Alzheimer's disease, these amyloid plaques and neurofibrillary tau tangles, but in vivo. Presented here is increased tau PET tracer uptake in a group of people with posterior cortical atrophy relative to healthy controls, emphasizing tau deposition, particularly in so-called visual association cortex. Presented here is an individual with posterior cortical atrophy and another individual with more typical Alzheimer's disease. The predominantly parietal, occipital, or temporal tau deposition are broadly in keeping with their cognitive profiles, that is, predominantly visual or predominantly memory-led. Posterior cortical atrophy raises a number of questions, notably, why might some individuals have the same underlying pathology as in more typical Alzheimer's disease, but differ quite markedly in their symptoms? What are the reasons behind the relative sparing of so-called Alzheimer's disease signature regions of posterior cortical atrophy, such as the medial temporal structures highlighted here? And can developing our understanding of regional sparing and vulnerability in Alzheimer's disease perhaps provide a catalyst for the development of future therapeutic strategies? Atypical Alzheimer's disease refers to individuals who have the pathological hallmarks of Alzheimer's, but whose initial and prominent symptoms do not characteristically relate to memory. Instead, their symptoms may relate to difficulties in their vision and spatial awareness, such as in posterior cortical atrophy, or in other individuals with language, planning and behavior, and movement. Such individuals tend to develop symptoms in their 50s to 60s and often face particular barriers in receiving an accurate and timely diagnosis. For example, many people with posterior cortical atrophy often spend years being told they have symptoms of stress or menopause, that they're burnt out from work, or be misdiagnosed with having had a stroke. Some of the most common experiences relate to seeing one eye health professional after the other, all the while being told that for the symptoms they're reporting, that these cannot be accounted for by any eye condition. But this not necessarily prompting referral to see a neurologist, neuro-ophthalmologist, or dementia specialist. Beyond raising diagnostic scenarios, clinical and biomarker advances, and research questions, this review makes recommendations for the appropriate support and treatment for people living with posterior cortical atrophy. For example, it recommends that people with PCA may be eligible to register as being partially sighted, even if their visual difficulties arise from brain sight rather than eyesight loss, and that people may benefit from certain professionals and approaches which are tailored to their particular symptoms. Highlighted here are examples of early and often life-limiting consequences of posterior cortical atrophy, loss of reading ability, and a tendency to become disorientated in both familiar or unfamiliar surroundings. Through people with posterior cortical atrophy who volunteered their time for research, we gain insights not only regarding how neurodegenerative disease may undermine aspects of vision, but also which perceptual conditions may support visual functions for people with posterior cortical atrophy. We've applied this understanding in the development of aids to promote reading as an independent activity, or environmental adaptations to support navigation based on strategic use of contrast or visual motion. Presented here is a point of view video from a PCA participant with her recorded gaze position indicated by this circle, as well as lighting adaptations to promote more confident and efficient walking. Presented here from a bird's eye view are walking paths of participants with posterior cortical atrophy determined using movement sensors, with these detecting a reduced tendency to take slow or hesitant steps indicated here by these colored markers, especially when restricting lighting variability and minimizing stark shadows. Now, I'd like to acknowledge the role of posterior cortical atrophy support groups through organizations such as Rare Dementia Support. So these groups have not only enabled peer-to-peer support for people living with PCA across the world, but have also encouraged exchanges between researchers such as myself and people with lived experience of PCA, not only initially in steering avenues of research, but later on in promoting the effective translation and dissemination of research findings amongst professional and public audiences.